Today we speak about the respiratory disorders in pathophysiology subject, and we say that we have three main disorder. We want to speak about it today as respiratory disorders. We want to speak about pneumonia and asthma as well as pulmonary edema. And also we say pneumonia is the inflammation of the lower respiratory part. Here we see that the alveoli are normal, well vasculated, and also it is distant due to the presence of the surfactants. And also we define pneumonia as infection that inflame lung and mainly the functional unit of the lung, which is the alveoli. And also we say that the air sac may be filled with fluid or pus. This is according to the type of inflammation. And also we list some clinical sign and symptom like fever, sweating, shaking, chills, cough, shortness of breathing, stabbing chest pain, and nausea and vomiting, as well as loss of appetite, and finally confusion. And this is very important, the clinical sign, especially the last one, which include the coughing and confusion as well as shortness of the breathing. Also, we list three types of pneumonia related to its cause. We have bacterial pneumonia, which caused by pneumococcus, Haemophilus, influenza, and Moxilla, and Catarrhalis in the group of A, Streptococcus. As well as we have a viral pneumonia. This is caused by respiratory syncytial virus or parainfluenza virus or adenoviruses. And finally, we have a fungal pneumonia. This is caused by a fungus like Histoplasmosis, blastomyces, and finally coccidiosis. And also we classified the type of pneumonia according to its gain. It may be gain from the hospital, and we call it hospital-acquired pneumonia. And sometimes we get pneumonia from community with the infected person, and we call it community-acquired pneumonia. And sometimes it is aspiration pneumonia when we aspire fluid or food which enter the respiratory organ, especially the lung. And here we see the normal bronchi, which is well opened, and you see very fine lumen. And the second bronchi is there is thickness because it inflamed. There is a thickness in the bronchial wall as well as narrowing in the lumen of the bronchi. And see here we have a mucus or pus which fill the bronchial and maybe obstruct the airway passage. This is include the alveoli. This is the air sac. You see, this is a normal air sac. This is very healthy alveoli. But here you see the alveoli filled with mucus, and there is no space for the air to exchange with the capillary, as well as the capillary become less, and it will be emphysematous. And we speak about respiratory acidosis and alkalosis and asporosis. We speak about the mechanism when we have hypoventilation, we have hypoxia, and if it has decrease in oxygen pressure in the blood, we call it hypoxemia. And we see that the normal partial pressure is 19, while the CO2 is 45, and the normal pH of the blood, the arterial blood is 7.35, and the venous blood 7.45. And when we have increase in HCO3, we have decrease in the pH, and this is what we call it acidosis. And the opposite of it is the alkalosis. Alkalosis, that means decrease in HCO3. That means we have H2CO3, we have less hydrogen free in the blood, so we have alkalosis, and there will be homeostasis, normal homeostasis in the body, which done by the respiratory system by the decrease or increase in respiratory to homeostase the pH of the blood. And also we speak about how to diagnose pneumonia by chest x-ray or blood test for white BC or RBC. Also we can check it our pulse by oximeter. We check the pulse as well as the oxygen pressure in the blood. Is very important measurement for to evaluate the oxygen partial pressure in the body. Also, we say that treatment, we can treat pneumonia according to its type, and mainly we must take rest and take antibiotic as supportive treatment. But if we have viral infection, it need more quality open treatment as in COVID-19, and maybe the healthy people must be vaccinated, because if they're infected they cannot need vaccine, need just treatment. And also we must take it plenty of drinking fluid and water, and also if it is very severe we must take our way to the hospital to take a perfect medication and management. Also, we speak about asthma, and we say that it is a condition in which the airway will be narrowed. That means the air passage of the bronchi, bronchioles, and respiratory tract. And also, there will be excessive production of mucus. Also, this obstruct the passage of the air. This is asthma, and it have many clinical signs, symptoms like shortness of breath and chest tightness or pain, wheezing, and exhalation, especially in children, and the trouble in sleeping as well as coughing. And here is a slide. We found the difference between the normal bronchial and the asthmatic bronchial. You see it. The lumen is very narrow and nearly obstruct. Also, I speak about the mechanism of vasodilatation and its relation with the bronchoconstriction. And we say if we have any allergen enter the body, there will be activation of many type of cell like mast cell and our inflammatory cell, and the mast cell secrete histamine, and the histamine lead to vasodilatation, and vasodilation lead to increase the permeability of fluid to the interstitial spaces, and this is stimulate the nerve ending which found in the area, and there will be a reflex from the area by sensory nerve, and then it retained by cholinergic motor nerve reflex and lead to contraction of the muscle which located at the bronchi or bronchiole, and lead to a bronchoconstriction. And I mentioned the opposite relation between vasodilatation and vasoconstriction. If we have vasodilatation, we have bronchoconstriction, and the opposite of that. And finally, we speak about the pulmonary edema, and we say that pulmonary edema can be caused by increased pulmonary capillary pressure and decreased plasma oncotic pressure and increased negative interstitial pressure, which is mainly in lung and the skin, or damage to the alveolar capillary barriers, and maybe we have lymphatic obstruction. All these mechanisms lead to accumulation of fluid in the pulmonary or in the lung interstitial tissue and lead to pulmonary edema. Also, you see here in this illustration, we have the three lines which lead to pulmonary edema, either inflammation or pulmonary venous pressure, or due to heart disease, and also either by dysfunction of valve or heart muscle, and this also lead to increase the permeability of veins in the lung and lead to edema. And here you see this is X-ray and this accumulation of fluid in the lung tissue. This is the cloudy space. This is cloudy place. This is the accumulation of fluid in the lung tissue. This is all for respiratory disorders, and thank you very much.